Now, skeletal services have continued in federal government-owned hospitals as the warning strike by the Health Workers Union enters its fourth day. Adisa reports.
These are unusual times at the University of Abuja Teaching Hospital in Gwagwalada. Like other federal government-owned medical facilities nationwide, members of the joint health sector unions are on a 7-day warning strike. The impact of the strike is already being felt as the hospital puts new admissions on hold while patients fit enough have been discharged. Only those in critical condition are being managed here. Record stores, pay points, laboratories and the pharmacy are deserted. Patients say life has been difficult.
Coming and seeing the doctor was not the main problem. Accessing my folder that will be used to process my condition, that was the problem.
They give me some paper here, said I should go and run tests. Went to where I will run tests, he said there's no around that they strike. That I should come next week.
Bisala Ekele is the chief medical director of the hospital. He tells me the notice of strike gave the management ample opportunity to make adequate plans for situations such as these.
We had to rearrange our priorities. For the main hospital, the number of patients that are coming to the outpatient clinics, maybe because of the announcement that there was strike itself, reduced significantly.
But he says the isolation center in the hospital is in no way affected by the strike.
The workers that are there originally were volunteer health workers from the beginning and have always been there attending to the needs of the patient.
Doctors explain how they have been coping.
No new admissions since this GSO strike. Emergency points are not also working. The patients we have in the ward are the ones we see.
The striking health workers are glad their action has been effective so far, but call on the government to arrest the industrial action.
Members are very cooperative. I want to believe you enter into the wards and you have checked the clinics. Everywhere is empty, which means for me in Gwagwalada, I think we have, I would say 99.922 compliance.
The health workers have warned that the strike may be full-blown after a review, but patients pray and hope for an end to the difficulties they have encountered in the last few days. Adisa, TVC News, Abuja.